Here in Albany, we're what's called the Regional Resource Centre. So Albany, a town of about 30,000 people, centre for maybe 60,000 people, but we're over 400 kilometres away from Perth. So that means we've got to be relatively self-contained down here, medically, in terms of the things that we're able to do. The region that we cover is about the size of Belgium, and within that we've got various scattered small communities who've each got a local hospital. Now we act then as the referral centre for them. From the hospital here in Albany, we support the smaller hospitals across the region and provide services to patients all across the region. We do a lot here. What do we send to Perth? Cardiothoracic surgery, spinal surgery, neurosurgery, people who require cardiac cath lab work. Very top end stuff that we send away, but pretty much everything else we aim to do here locally because we believe care close to home is better.
Although it's a country town, that most things are actually on site. They've got like imaging here, they've got pathology here, so all the support services for what we need to do.
We have allied health, we have all of the professions, physiotherapy, occupational therapy, social work, we have dietetics, and we have speech pathology. They look after inpatients and they also look after outpatients, and of course they're part of the hip fracture team, known as the hipsters, that make sure that we comply with the clinical care standard for the treatment of patients with fractured necks of femur. We have a very good emergency department which is seeing about 33,000 patients a year, staffed by a combination of FACEMs, senior medical practitioners plus junior staff.
We've got a high dependency unit here in the hospital. That's staffed by visiting specialists who fly in and out from Metro. A number of reasons for that. One of the prime ones being that we don't have an intensive care unit. But we do have intensivists who travel down. So we're really fortunate. We've had a great relationship with a group of doctors who've been visiting us on a rotating basis now for many years.
So the hospital's achieved accreditation against the Australian Council of Healthcare standards. We had a recent inspection. Everything was met on the first attempt. So that's very satisfying because not too many hospitals achieve that these days. We're also accredited for training in general surgery. And we have a service registrar in orthopaedic surgery.
We've been part of the national hip audit for patients who've broken their hips and having surgery, and we've up to now performed very well in that.
So it's a combination of acute emergency work, so whatever comes through the door, including fractured hips, and they also will do elective clinics and elective surgery, and of course there's a fracture clinic and a follow-up clinic.
From an orthopaedic point of view, the service can manage joints pretty much as big an operation as you would do in the metropolitan centre. If the patient's well enough to be in a high dependency and down, then the operation can be done here if you're comfortable doing it.
So that whole range of orthopaedic services that we would expect to provide, and that would be whether it be trauma, hips, knees, and also if you've got subspecialist interests in areas like shoulders or whatever, then we would encourage practitioners to do that.
The chance to actually build the service how you want to build it is actually open and available. So you get the opportunity to start as either a young surgeon and build it up, or come as a slightly more senior surgeon and bring things in the way you want to do.
So the private component is the Great Southern Specialist Centre, which is where you would see your patients, and there's an Albany Day Hospital where you could do day surgery. You can easily do that.
So we really do encourage people and clinicians coming to work with us to have portfolio careers where they can pursue areas that are of interest to them, because we want people to be fulfilled, enriched and enjoy their work with us.
There's a lot to do outside of medicine if you decide you wanted to come and live here. It's got the best coastline, it's got great weather. If you like your sport, there's bike trails, fishing, kayaking, canoeing. If you like hiking, there's marked tracks, unmarked tracks. You can walk through the Stirlings, you can walk through the Prongerups, all within half an hour to an hour's drive away.
One thing that was a revelation to me that I didn't know before I got here is we've got some extraordinary wineries here, and the quality of the Great Southern wine is outstanding. So if you like your wine, this is a place to be. We've also got lots of paddock to plate here. There's a really strong and developing food industry here. We've got farmers markets, we've got the boat shed markets. There's a really active cultural life here, and we're only 4 hours from Perth. Now I realise for people overseas that might seem like a long distance, but by WA standards that's pretty close. It's a 1 hour flight. We've got capped flights in terms of cost, return flights for people who are residents in the area. So as a place to live, I think Albany's got it all, because we're here in the country. We've got all the benefits of being in the country, but we're close to metro.
You know, it's a much more gentler way of life and much less stressful. Most days after work, we just go, even if it's just a 15-20 minute walk at the beach, which is so near, and it's amazing, you know, because I used to live like hundreds of miles from the sea, so suddenly we get the sea, we get the breeze. Albany is just very nice and a little bit quieter, which gives you time and a bit of headspace to do the more gentler things in life. Definitely for somebody who is looking to escape the rat race and just chill and just sit out and have your glass of wine on the patio and, you know, just go to work where everybody's very nice to you, then this is the place for you.